How to Have a Successful Clinical Psychological Interview by Cassy Cammarano. Well, first things first. Appearance and professionalism is very, very important. The way the interviewer is dressed and how they carry themselves, along with how they have their office and environment set up, can significantly influence the client's perspective and trust towards them. The interviewer's attire should be professional, clean, neat, and modest, and their office and workspace should be clean and organized. The interviewer's appearance is more than likely one of the first cues a client sees and receives. The client is more than likely to feel respected and taken seriously if the interviewer's attire is professional. This will also help the client to build immediate respect and trust with their interviewer. Professional appearance and an organized workspace can also set healthy boundaries between the client and the interviewer. So, it is important for the interviewer to set the environment up to be welcoming, quiet, and comfortable for the client. The initial greeting should be, as said, welcoming and warm with a warm introduction. The interviewer should be mentally and emotionally present. The interviewer's body language should be open. The interviewer should show interest and compassion towards their client. The interviewer should assure the client that it is a safe space, that the information shared within the room or the office is not going anywhere. The interviewer should briefly go over what is going on in the interview, the structure, the purpose, and the expectations of the interview. Verbal communication. The language the interviewer uses should always be non-judgmental, encouraging, supportive, and culturally present and aware. It is important for the interviewer to be confident in what they're saying, to speak clearly and with an honest and welcoming tone. Some do's and don'ts. The interviewer can ask questions such as, how does this make you feel? And we'll get into this in a second. And a don't would be for the interviewer to use technical jargon, which the client may not understand. This type of language can make the client feel uncomfortable or even feel intimidated. The interviewer can encourage the client to share more about their situation by summarizing the client's statements and asking open-ended questions. So within open-ended questions, asking these types of questions will allow the client to feel safer in sharing their personal experiences and in expressing their feelings or perspective on them. Continuing to set this type of environment can lead to deeper conversations and understandings of the client for the interviewer to assess, or even for the client to understand about themselves. Some do's and don'ts. Do. Use what and how questions instead of why. Don't. The interviewer should not ask questions that may seem accusatory or judgmental. Within open-ended questions, the interviewer should ask questions focusing on demographic, age, religion, gender, family composition, socioeconomic status and relationship status, past medical records, family medical background, past and present psychological records, the client's current mental or emotional state, and past interactions with mental health professionals. Now, nonverbal communication. This type of communication is also extremely important in this type of interview. So, nonverbal communication within the interview, it involves not actually speaking, or audio, but it involves active listening, tracking the client's eye contact, being aware of the client's body language gestures, being aware of the client's facial expressions. Having an awareness of nonverbal communication from the client will allow the interviewer to have a deeper understanding on what emotional state the client may be experiencing. Only the clinician giving the interview is permitted to ask follow-up questions regarding the client's symptoms or experiences to better support their psychological observations and clinical decision-making. Follow-up questions are extremely beneficial as they help the interviewer ensure that they are gathering the most accurate information from the client to provide the most appropriate responses and resources and healing modalities for the client. So within follow-up questions, we'll get into some questions to ask and questions not to ask in a second. So asking follow-up questions can allow the client to feel heard and seen. They may encourage the client to delve deeper into a specific topic or personal situation without feeling pressured. Some questions to ask. How did that make you feel? How did that impact you? How do you cope when you feel this way? How do you interpret the situation? What do you wish could be different? Have you noticed any patterns in this? And some questions not to ask. Why can't you just stop feeling this way? Why are you making such a big deal out of this? What if you never get better? And tell me everything about your experienced trauma today. That, of course, can make the client feel pressured into sharing information that they may not be ready to share. So, ending the interview. Of course, the intention of the interview is for the interviewer to have a better understanding of the client and for the client to have a better understanding of themselves. It's important to conclude with support, encouragement, and clear specific goals for the client. The interviewer can summarize the key points of what was discussed and actively reflect on the strengths of the client and how to proceed further for them. It's important that the client gets the necessary homework. That includes the specific assignments or reflections needed in order for them to grow and to understand their active patterns and to ultimately heal. So this type of interview is extremely beneficial for the client and overall one of the most important and successful types of interviews to have for the success of healing for the client.